Hi and welcome to another video where I'm demonstrating the document feature of the DCP. The DCP enables an advanced templating system to create complex documents based on patient information. And I'll just go through and demonstrate one particular template, the mental health care plan, and then you'll perhaps understand this better than if I go through complete instruction on how it came about and how it works. So we're just going to do a mental health care plan. So with the patient open, we have a mental health care plan prompt in the MBS items section. Now to access the patient-centric document feature, go to functions, and the very first one, patient-centric documents. When you click on that, it will open the patient-centric document form. Now we have here on the left the list of patient-centric documents. We're interested in the mental health care plan, so we double click on that and it opens up on the right. Now the initial display is just in the editor. You don't need to edit the document, but there are instructions on the top of the editor, and that's why it opens on the editor, just so you can read the instructions in red. And that will tell you to open the service providers tab, set the psychologist, use the questionnaire tab, switch to the preview tab, and then copy and paste into clinical software. So if we do that, we go to the service providers tab. To select the service provider, you have to click on the category, the psychologist, and then click on the drop down and select one from the list, then click away, and it will set the psychologist. You can clear it by clicking away after clicking the clear button. So we'll select a psychologist and go to the questionnaire tab. Now the questionnaire tab contains the meat of the project, where we're going to create a complex document based on this patient's documented history. This patient in particular has a history of anxiety and depression, so in the questions will be questions related to depression. So we have a K10 depression screen, we also have a Hamilton anxiety screen, and we have some management items below related to depression and suicide risk and so forth. And this complex document becomes just a matter of clicking through the different questions, which will turn green as you progress through. And we want our psychologist to review regularly. Not going to worry too much about those. And if we scroll down, now we can add in text comments about other conditions, the description of the presenting complaint, the impact on functioning, general health care, contact, and some details on education, language, previous referrals, family history, social history, substance abuse. So we can just type that information in. Of course, when you type information in, the question goes green. The K10 questionnaire is fairly easy. I'm sure everyone's very familiar with doing a K10. We have the Hamilton anxiety screen, also probably reasonably familiar. And then we have the mental status examination, the risk assessment for this patient with depression, and so forth. So once you've completed it and everything is green, we go to the preview tab. We can scroll down and preview the completed questionnaire. At this stage, of course, I haven't done all the questions, so the answers, which would normally appear to the right, are blank. Anyway, the way to get this into clinical software is just click copy, and that places a copy on the clipboard, which we can then go over into clinical software and paste. Now we have our completed document in our clinical software for final editing, so we can touch up and add anything that we wish to do so at this stage. Once we've done that, obviously, it's a matter of doing the usual print and allow the patient to have a copy with instructions, for example, that the Medicare item number takes a week or two to process, and so they'll need to make their appointment with the psychologist after 1 to 2 weeks. The psychologist details are in the service providers section, and one other feature I might just quickly point out is if the questionnaire has been done previously, so coming back 12 months later, we can reload our previous answers, which makes completion of the previously done mental health care plan much faster. And also, with regard to the depression screen, the K10 depression screen, it's possible to point the patient towards doing this by showing them the screen and giving them control of the mouse so they can actually quickly go through and do this part of the mental health care plan. And that's all for the moment. Thank you.